Bernard Tobin here at the Western Canadian Dairy Seminar. I'm joined now by Michelle van Huyssteen. She's a University of Calgary grad student. How's it going, Michelle?
It's good. It's always a good time when you have the dairy seminar going on and interacting with everyone from the dairy industry, so I enjoy it a lot.
Awesome. Hey, I just enjoyed your presentation. It was basically, where are we with lameness prevention and control? A big issue in the dairy industry, obviously, is lameness. Before we get onto that, how would you define lameness?
So lameness is, to break it down, basically a clinical sign of pain or discomfort. So this results in the cow having an abnormal gait or what most people would consider as a limp. So that's kind of what we define lameness as.
Now, let's get to your findings. And you basically, the bottom line is we're not doing that well. In the last 7 years that you've studied, we haven't seen a lot of movement forward on this issue. Tell us about your findings.
Yeah, so there's been lots of research on risk factors on farm. However, given the scientific knowledge that we've now been trying to translate to the dairy industry, we've still not seen a reduction in lameness prevalence. So it still remains at 20%, and that means that producers are still not quite there with adopting prevention strategies to try and reduce this health and welfare issues. So that's the challenge we face right now.
So you've got about 20% average lameness. Your slide showed that you had some farms at 2% lameness, some as high as 56. Talk about, I guess, your risk assessment and the risk factors, on farm that, get farmers in that high number and that low number.
Yeah, so the risk assessment is, again, developed to try and increase that adoption rate by producers. So we're trying to break it down so that producers can find their critical areas on farm, and the risk assessment basically breaks it down by facility design and management practices. So that's where there can be a lot of variation between farms. And in terms of the farms that are at 2%, at least I've noticed that sometimes management practice might not be captured as well as it could be in the risk assessment, because that definitely dictates lameness prevalence a lot. So, that's another way we might have to adjust it. So
you're thinking, I'm thinking about risk factors. We're talking about, size of herd, flooring. Give us a sense of, what some of those factors are.
Sure. So when it comes to risk factors, it comes to risk factors for lesions because of that high association between lameness and lesions. So for non-infectious lesions, it has to do with stall design, standing time, and stocking density, as well as, flooring and slipperiness of flooring for sure. For infectious lesions, and again in this area and everywhere else, it's really just DD that's a big problem. And factors or risk factors are biosecurity, cleanliness of the environment, and also foot bathing is a big factor in how a foot bath routine is being carried out as well.
Do you get a sense from producers that you've talked to that they're aware of the issue, that it's important to them, and that they can make a movement one way or the other to better their management?
Yeah, I think a common theme I've come to know, getting to know all the producers that I have been on farm with, there's this sense that lameness is never going to go away and that it's just always going to be there. And I think some producers feel that it might be out of their control in terms of trying to reduce it in their herd. So I think that's kind of one of the big barriers we're faced with is that kind of lack of control that producers feel they have over something like lameness. But again, as you can see, we did have a herd as low as 2%. So they're obviously doing something that is possible. So,
maybe a couple more questions. That 2% herd. I mean, based on your research, what would you say is being done there to be that successful?
Yeah, I can definitely tell you because I remember that herd, and it was kind of a surprising result because their barn was actually very old. So facility-wise, it didn't seem up to par. But this is where the management side of things can really dictate how prevalent lameness is in their herd. So they were very on top of hoof trimming themselves in between their whole herd trims from their professional hoof trimmer. Whenever they saw some cow with a problem, they would put her in the chute and basically be on top of those routines as well as foot bathing. This is where the risk assessment maybe needs to pull a little bit more weight on that management side of things, because that was a barn that surprised me in a way. Yeah.
Final question. You're looking at 7 years research. You told the group today that more work needs to be done. Where do you go in the future with this research down the road?
So, given the unchanged estimate of 20% in Alberta, which is still much too high, we still have to work closely with producers and, again, knuckle down on those barriers that remain and see what we can do. So we want to try and enter more of the qualitative methods by doing in-depth interviews, identifying common themes between responses of producers and why they're not able to prevent or control this issue in their herd. So we'll do that, as well as work on accuracy increasing of the risk assessment, because we believe that's a great tool as it is getting into that farm-specific approach, which is important because every farm, as I've said, is different from one another, so we need that approach for sure to work for us, and it's just about making it a bit more accurate and having that communication between producers and their advisors, like their vet and hoof trimmer, and getting the team together to really discuss that topic in their herd. So, yeah.
Yes, and we'll see you back here at future seminars with more insights.
Yeah, definitely. I look forward to it.
Thank you for your time.
Okay, thanks so much.